Hi everyone, my name is Holly Anderson, and for my final presentation, I chose to view the movie Dallas Buyers Club. So Dallas Buyers Club is based on a true story about a man named Ron Woodruff who was diagnosed with HIV and AIDS in the 1980s, which was a time that doctors and the government, the FDA, and pharmaceutical companies wildly misunderstood how HIV was transmitted. They didn't understand the disease at all. So the story follows him being diagnosed, being treated in a hospital, and then eventually being a part of a clinical trial of about 300 patients, where half of the patients were receiving a drug called AZT and half were receiving a placebo. So there were many bioethical issues in this movie, but I'm going to settle on just two. Another important part of summarizing this movie would be mentioning a doctor who originally worked in the United States, but had his medical license revoked because aspects of his work violated U.S. regulations. And it's worth mentioning that the approaches he was taking were helping patients who had HIV. The first theme I am going to discuss is beneficence, which considers the balancing of benefits of treatment against the risk and costs, and obviously acting in a way that benefits the patient. So balancing the benefits of treatment against the risks and costs. So we're already talking about a vulnerable population here. These are patients that have been diagnosed with HIV or AIDS, that have sought help at this medical institution where this clinical trial is going on for AZT. All the while, they are not being told by doctors the full scope of what the clinical trial entails. The negative side effects are never made known to them, and a lot of times the doctors are just blaming whatever negative side effects they're having on the disease, something inevitable, when in fact, the drug was causing a lot of these side effects. As far as the benefits go, some of the patients were feeling better. However, there's no direct correlation that can be drawn between the medication and the patients feeling better, because they were also having blood transfusions and other treatments related to pneumonia and diarrhea. So it was really hard to pinpoint if the benefits for the patients were actually coming from the medication. So I think in this case, the risks and costs far outweigh the benefits. Additionally, it would cost, in today's terms, about $17,000 a year for these patients to afford this medication. Many of them are already uninsured, are already part of this vulnerable population, and so it's just another form of exploitation, just another way that these pharmaceutical companies, this one was called Burroughs Wellcome Company, were looking to get rich on the backs of sick, low socioeconomic status citizens. Additionally, some of these patients were not given the full scope of the trial, so informed consent wasn't followed to the degree that it should have been, and some of these patients also were coming in and being forced while they're unconscious, having an IV put into them and the AZT delivered to their body without even giving permission. There's a scene where the main character has an episode and he's admitted unresponsive to the hospital. They tell him he almost died, but he had a blood transfusion and had a drip of AZT going into his vein, and as soon as he realized it, he ripped that IV out of his arm because he knew that it was poison. So we'll get to that on the next slide. So for the second theme here, I'm going to be comparing deontology with utilitarianism regarding this dilemma. So this is the hard part. Does the law make something right or wrong, or are these things circumstantial? Can you pick and choose? So we are going to explore that here in the next slide. So from my own personal learning in this class, I think that I've learned that these things are certainly situational. It's very hard for me now to judge things black and white. So this particular issue, looking at it from the deontological side. So deontology uses rules or laws to distinguish right from wrong. So you follow the rules and do your duty. It does not require weighing costs and benefits. But the problem with this side is that a lot of times it can produce results that many people would find unbecoming. So in this case here, Dr. Vass has this cure, not cure so to say, but a way to dull the symptoms pretty permanently for these patients. But U.S. regulations said no, he can't do that. So his medical license is revoked and he takes his business to Mexico where he can help people, and he is. He's set up a makeshift hospital there and he's helping people. So Ron gets his information and he travels to Mexico, undergoes a couple weeks of treatment for himself, and he's sold because his life has changed. He went from being on his knocking on death's door to feeling like a new man. So he sees multiple benefits, helping people who are vulnerable. Obviously, he's about to make a lot of money because he's going to come and sell it. And so thus is born the Dallas Buyers Club, a $400 monthly subscription. And it's not illegal because you're not buying the drugs from him. You are paying for a monthly subscription, and you just happen to get these vitamins and this protein serum. So he's found a loophole, and this loophole has created the greatest good for the greatest number of people, which is utilitarianism, which is a form of consequentialism. So Dr. Vass found this drug therapy, and he also knew that AZT was poisonous. But the problem is that vitamins and a protein serum and healthy lifestyle and healthy diet doesn't really make all that much money. So in this case, in my opinion, the utilitarian view wins out because the U.S. laws are not what make things right, unfortunately. And in this case, the most people benefited by getting this treatment. So in summary, clearly this work exemplifies many of the themes we've explored this semester. There's many, many more. So if you've seen this movie before, feel free to contribute some of those other themes on here. That would be awesome. As far as recommending this film, I would recommend it to those with a strong stomach because there was a lot of sexual content, really strong sexual content, drug abuse and foul language. None of that really bothers me too much, but it may bother others. I appreciated it, honestly, because it was shown as coping mechanisms for a lot of these people who had just discovered they had this horrible, uncurable disease. So then the question goes to you all. What would you do?